There are a lot of adult patients who seek out orthodontic treatment for a better aesthetic look, maybe a functional improvement, a more comfortable bite. Maybe they have too much wear on their teeth and they want to have a more balanced force distribution. Maybe their dentist says they're having a hard time keeping their teeth clean and they want to have alignment for that reason. But there are a lot of adults who cope just fine with misaligned teeth. Orthodontic treatment is really not mandatory, assuming that you have reasonably good oral health, good genetics, no active disease in your mouth. But here's the point I want to drive home. When it comes to retainers at night, we recently, about a year ago, finished treatment on somebody. It was about a year-long Invisalign treatment. She was a very diligent patient. She came back the other day, hadn't worn her retainer. And this is, a mature adult. This is not a teenager. Her teeth were pretty crooked again. And she said that her mom was sick and she had a lot on her plate. And, maybe in the past I might have dismissed that in my head and thought to myself, okay, so you just can't wear a retainer at night, even what's going on. And maybe to some extent that's true. But what she was really telling us was that the orthodontic treatment that she sought out, that was important to her at that time for whatever her reasons was no longer a priority for her. Now, of course, she wanted to seek what could be done. But my point is that this is a choice you make. If you choose that you want your mouth to look better or feel better, you have to follow up and be diligent long term. And you know what? 10, 20 years from now, your thoughts may change. This is not permission for you to stop wearing your retainer. But this is try to give a little bit of empathy that there's a lot of things going on in people's lives. And more than that, there are priorities that we have. I don't work out like a crazy person. I've gained about 10 pounds. I don't do any hair transplants. I'm fine. A lot of people are fine. But if I chose to want to look the best, the youngest I could be, there would be some work involved with that. And when it comes to orthodontics, the work is wearing your retainer. You're either going to do it or you're not. That's your own choice.